Hi, welcome to my channel Medicines with Abdul Ali. In this video, I am going to share with you some knowledge about Enalapril, its uses, its strength, its side effects, and precautions. So, what is Enalapril? Actually, Enalapril is an AC inhibitor. AC stands for angiotensin converting enzyme. It is used to treat your high blood pressure, hypertension. This medicine is available all over the world. In the US, Vasotec is a brand name and Enalapril is a brand name in Pakistan. It is available everywhere in every store. It is a very important drug. This medication is used to treat high blood pressure, and off the label it can also prescribe for kidney function. Whom kidneys are not functioning well, and it's also used for heart failure. Heart is not functioning well, so this medication is prescribed for those. Remember, this medication is not prescribed during pregnancy because this medication can cause birth defects. Now, coming to the doses of Enalapril malate, it based on the person and condition of the person. For heart failure, generally a 2.5 mg per day tablet should be started, and it can be increased slowly up to 20 to 40 mg. Now, if you are on 40 mg, you can split it into 20 mg. You can take 20 mg at morning and 20 mg at night. Your healthcare provider help you determine that, but not more than 40 mg per day. No, for a high blood pressure patient, again the 2.5 mg per day should be started and can increase slowly up to 40 mg per day. Don't take more than 40 mg per day. And we also see it paired with other diuretics like amlodipine and hydrochlorothiazide. You can increase this up to 40 mg, and of course it also uses for other condition depending on your health condition and the doctor using for it. So the doctor will decide. So the side effects, have some common side effects and some rare but serious side effects. On a whole, it is pretty well tolerated medicine, but it can increase your serum creatinine level, increased your potassium level, increase your dizziness states. It can also cause dry cough, diarrhea, headache, and of course some others not listed here. Now, some rare but serious side effects. But remember, these side effects are only in 1% of people. First of all, talking about angioedema. What is angioedema? Angioedema is a swelling of your throat, neck, and very difficulty in breathing. So this is angioedema. That's very serious. Now, birth defects rashes, severe liver problems, change in your heart rhythm, heart rate, changes in electrolytes. You can be a little bit too much, so you can lose minerals, vitamins, and salts. So your BP always goes down, and you feel some weakness. And you can also muscle aches. Please subscribe into my channel Medicines with Abdul Ali. For more videos, please visit my channel. Thank you for watching my videos. Love you. Thank you very much. Bye bye.